Hi, I'm Dr. Richard Gray, and I'm one of the co-directors of the Breast Center here at the Mayo Clinic in Arizona. If you've recently been diagnosed with breast cancer, I know it's a scary time, and we want to give you some information that will hopefully help with that. There are three things that I really want you to keep in mind. The first is that most people diagnosed with breast cancer can be cured of this. We know that when you hear the word cancer, you think of the worst possible outcomes, but you should expect, in most cases, that you can be cured. The second thing to keep in mind is that you do have time. I know it feels like an emergency to get treatment started for breast cancer, but you do have time. You have time to make sure that you understand your treatment options. You have time to make sure that you have a good treatment team that you're comfortable with, and you have time to think through your options and make sure you're comfortable with them. So again, while it may feel like an emergency, please take the time that you need to make sure that you're comfortable. And the third thing I want you to keep in mind is that your experience is very likely to be different from others you know. When you get a new breast cancer diagnosis, many times people share their stories with you, and those can be very helpful, but sometimes can also be scary. And so past treatments are very different from current treatments, and other people's situations may be very different from yours. For the vast majority of women, surgery is really the first step in their treatment of breast cancer. And for almost all women with breast cancer, they have two very good surgical options available to them. The first is to undergo a lumpectomy. Sometimes this is called a segmental mastectomy, but what it means is removing the tumor from your breast with a small margin of normal breast tissue around it, kind of a zone of safety to be sure all of the breast cancer cells have been removed. That is then typically, though not always, followed by radiation treatments afterwards to your remaining breast tissue. The radiation can be done in a variety of different ways, but the most common is to have radiation treatments for 3 weeks, a few weeks after you've healed up from your surgery. The other option is to undergo a mastectomy, meaning removing all of your breast tissue. If one has a mastectomy, you can have immediate reconstructive surgery, meaning the reconstructive surgery happens at the same operation as the mastectomy. And nowadays we have good surgical options that mean most women, if they choose reconstruction, can have their breast skin and even nipple spared in the process of the mastectomy. The important thing to know with these two options are that they result in the same cure rate. So many women feel like if they do a lumpectomy that it's smaller surgery and they might get less of a cure rate, but it's not true. Several studies done many years ago have shown that when women were randomly chosen for a lumpectomy or a mastectomy, 25 years later their cure rates were the same. Because they produce the same cure rate, then the decision between these two options can be made on other factors. Things like, do you want to undergo radiation if you need to do so after a lumpectomy? Would you get more peace of mind by undergoing a mastectomy with reconstruction? And several other things that we can talk about with you in terms of your goals and your priorities in your treatment. Are there exceptions to that? Yes. Some women do need to have a mastectomy. For example, some women have more than one tumor in more than one location of their breast, and it's not feasible to do a lumpectomy because of that. There are some women that have a tumor that maybe is too large to do a lumpectomy. Now, in most cases, we can give some other treatments before surgery to shrink that down and still make a lumpectomy feasible, but there may be exceptions. But remember, these are exceptions to the rule. And so for most of you that are facing a breast cancer diagnosis, you would have good surgical options and both of these surgical options available to you. One other exception that I will mention is some women would benefit from having chemotherapy before surgery. Now I know chemotherapy is something no one really wants to hear about, but there are certain types of tumors where we know chemotherapy is going to be of benefit. And if we know it's going to be of benefit, it's often good to give it even before the surgery so we can gauge how the response is of the tumor to that treatment. So thank you for choosing to meet with us at the Breast Center to help care for you in your breast cancer journey. And I want to reassure you that you've made a good choice. You will have an expert team of breast cancer specialists in all of the applicable specialties that will come together in one place, under one roof, in a coordinated way to make sure that you have the best treatment options and the best outcomes. We will make available to you all of the latest techniques, all of the latest treatments. You will also have an opportunity to have cutting-edge treatments through clinical trials that will offer new drugs and new techniques. And we have available to you individualized precision medicine, whether it's based on your genetics, the genetics of your tumor, or other individualized factors to make sure that we choose the right treatment for you. So we look forward to meeting you at the Breast Center at Mayo Clinic in Arizona.